definition of codependency is very, very simple. First, you're not a victim, you're a part of the problem, you're a participant. Codependency is as follows. It is a psychological problem that manifests in relationships. It's a problem of the distribution of love, respect, and care. Codependents give all the love, respect, and care to others, and they expect it to be reciprocated, and it's not. They get upset, they try to control it, and they stay in a relationship. They struggle with intense loneliness and shame and are addicted to their narcissist because of the attachment trauma they experienced as children. The codependency cure understands the dilemma of the human magnet syndrome. Codependents, because of their attachment trauma and all of the foundational explanations for why codependency persists, they understand that it's nearly impossible for their client to break that pattern. And today you're going to learn not only more about that, you're going to learn how to solve it. But if we're going to understand the necessity of this codependency cure work, we have to understand how seemingly intractable, how seemingly permanent, how permanent for so many people codependency is. My mother, my grandmother, my great-grandfather died codependent. If many people will never know what is the opposite of codependency. Because first of all, the field of the mental health field doesn't understand it, and the therapist doesn't understand it. This is a problem with trauma that impacts someone's ability to love themselves. Codependency, if not solved according to the dynamics that created it and the dynamics that sustain it, last. It's analogous to an infection that only responds to one type of antibiotic. If you don't know that one type of antibiotic, it's just not going to work. And today I'm going to explain the antibiotic. What's important for you to know is that the therapy for it to work has to fit the problem that is identifiable, that is understood. The therapy has to fit the problem. It has to be logical and whenever possible research-based. And today, the codependency cure is going to fit the human magnet syndrome. I have been working really hard to get rid of the word codependency. I dislike that word. It's overused, it's misunderstood, it's shaming. Our clients don't like it. It's not respected in clinical circles. I want to get rid of it. We have to have a name for a problem that makes sense. Major depression. Well, that's major depression. That's a disorder. Generalized anxiety disorder. Anxiety. Attention deficit disorder. Well, people have the diagnosis. It should fit the problem. Self-love deficit disorder describes the problem as the person experiences it. I was looking and looking and looking and waiting for a replacement for codependency. And just like a lot of my other ideas, they just come to me, sometimes during a therapy session, sometimes in a dream. And when I came up, I said self-love deficit disorder. And it's like I almost fell out of my chair because I knew it explained the problem and people would identify it. It's kind of paradoxical. You would think that, well, codependency, people don't like it, it's very shaming. And self-love deficit, who wants to say that they don't love themselves? But when I started talking about it in my trainings with my clients, in my YouTube videos, everyone loved it because it felt true to their experience of codependency. The name identifies the problem, and the name identifies what the goal should be. Sometime after that, I thought to myself, well, it's As much as you don't like negative diagnoses, you know, SLDD is a little bit on the negative side. And I thought, this is not a normal problem. This problem can be cured. Codependency, self-love deficit disorder, can be cured. Having the name for the solution emboldens clients. When you talk about the problem and say, well, this is a problem with self-love deficit, and what we're going to do is going to help you learn to become self-love abundant. I promise you, it just makes sense. It just clicks in. What I've come to understand, codependency treatment doesn't work. It's because everyone is treating a symptom. If you come in and you say, oh, you know, I have a pain in my belly, and your doctor says, well, you know, what type of food are you eating? He says, well, I'm eating, you know, a lot of fatty food. Well, quit eating fatty food, okay? And your pain gets worse, and because they're treating the symptom. The medical field looks at a problem, and they trace it back, and they try to get what the symptom and what the problem is. Therapists need to do that more, because so many therapists are treating codependency and all they're doing is treating a symptom. Start setting boundaries. Learn to say no. Let go. Quit controlling. Take care of yourself. What happens to the client when they are given this advice? Leave the son of a, go to a shelter. What happens to that client when their therapist says these common sense suggestions and they can't do it and comes back? More shame. And as we will learn, and some of you guys heard yesterday, well, shame is a constituent component of self-love deficit disorder. So the therapist unknowingly are making the problem worse. It is a fourth level problem that comes from the first level of trauma. SLDs are born to pathologically narcissistic parents. And because of the human magnet syndrome, that if there's a marriage that's intact or a partnership that's intact, there's a very high likelihood that the other parent is codependent. SLDs have suffered attachment trauma, which has caused core shame, which has caused pathological loneliness, which has caused an addiction, which has caused this compulsive need to medicate their pain. And from there, we have the pyramid. This, if there's one graphic that you'll need in your practice or for yourself, this is codependency. I'm not tall enough, but SLDD, at the very top of the pyramid, is codependency. That is what people come into therapy for, and that's what the therapist, more or less, are treating. And SLDD cannot be solved if you don't solve the other problems. But you can't solve it by going from top to bottom. So let's look at each level of the pyramid. Attachment trauma, developmental trauma. Children need unconditional love. We, as higher level mammals, primates, humans, and other advanced mammals, the children need nurturing, safety, in order to develop social skills and psychological abilities that enhance their survival. There's all sorts of research that proves this. If you have a parent who's a pathological narcissist, you had conditional childhood attachment, neglect, abuse, and deprivation. As we talked about yesterday, the pyramid looks different if you're a narcissist, but we're not talking about a narcissist. From that, you have a disassociated childhood trauma and repressed memories of abandonment From attachment trauma, which is unconscious, our clients are not aware of the trauma, and in most cases don't remember the events. If they remember the events, they're not aware of the feelings and the harm that it caused. It is unconscious. It is disassociated. From attachment trauma comes core shame. It's a believing that you are fundamentally bad or flawed. It is a feeling that something is always wrong with you and you can never be good enough. From core shame is this feeling of intense loneliness. I call it pathological loneliness because it is an experience that supersedes normal loneliness. It's deep, aching, lonely pain. Excruciating feelings of worthlessness and loneliness and an existential void. It is horrible. Who here has worked with codependent clients and or identifies themselves as codependent? And I'm going to ask you your brief experience with pathological loneliness, and no one will know if it's you or your client. Has your clients, your SLD codependent clients, ever talked to you about loneliness?
Yeah.
Okay.
Actually.
So what she said, to paraphrase it, loneliness, her experience in her own recovery was the deepest, most profoundly painful experience that she ever had. It was disturbing, and it felt like it would never go away. Yes. And what she said was, she thought that was just the normal life, the background noise of life, and that was her outer emotional skin, and she's stunned by its explanation. So, okay.
For me,
What she said was, loneliness in itself, as a physical descriptor, is bad. But loneliness when you're with someone else is even worse. In this training, the light bulbs will go off, or you'll learn something new. And I promise you, remember, if your toolbox has a few tools, you will never know what something is and you won't ask it. So if you are a therapist or you are struggling with SLDD, and I say this to both of you, you start talking about your loneliness and everything starts to take shape. From that comes addiction, and I'm going to be talking about this in more detail, but if you have this loneliness ache, and I know, boy do I know this, and I know that pain. And I know the pain around people, and I know the pain inside. You need a way for it to go away. And how does loneliness go away? By being around someone. And if you are broken inside, and the human magnet syndrome actually does work, who are you going to find? Not Ghostbusters. The pathological narcissist. And that's the drug of choice, and that's the addiction. And then we have codependency. Selfless, compulsive caretaker who habitually attempts to control others into loving them. So this is a wonderful illustration for the problem, and it explains why, for so many people, they've never been able to resolve it, because you're working on the wrong thing.